With me here today is David Walker, an involvement officer from the Roy Castle's Lung Cancer Foundation, and Sally Convery, a lung cancer nurse. They will be discussing an information day which will take place in the Hilton Hotel on the 19th of May. David, could you tell us a bit about the Roy Castle Lung Cancer Foundation and what the foundation aims to achieve?
Well, the foundation was founded over 25 years ago, and as we're the only lung cancer charity in the UK, which can be quite a shock to people, you can imagine it's a big job that we've got to do with the foundation, as lung cancer is the biggest cancer killer in the UK. We have our information service, which provide our support to patients and carers, and we also look to do research, but we will also support our lung cancer nurses throughout the UK, whether it's via funding, by information materials. So we really look to help a wide range of people affected by lung cancer.
And Sally, you're a Macmillan nurse. Could you tell us about your role with the Trust?
Well, I'm one of 9 lung cancer nurses throughout Northern Ireland, and we provide support at diagnosis, through treatment, at the end of treatment, into survivorship and end of life care. We have over 1,200 patients diagnosed every year in Northern Ireland with lung cancer, and over 2,000 people living with lung cancer in Northern Ireland throughout any given year, which means 9 nurses to look after that population is a very small number.
And David, tell us about this information day that's going to be held on the 19th of May.
Well, the Lung Cancer Information Day is designed for patients, carers and anyone affected by lung cancer, and we have a number of speakers attend. So we have always a thoracic surgeon attend and an oncologist, looking to give both angles of treatment so patients and carers can have all their questions answered. And we also have people such as Sally attend the event who do a Q&A, so people can can get their questions answered, and which they always have a lot of questions because then they don't necessarily have enough time in a hospital setting to get what they would like asked.
Could you tell us a bit about the support groups in the Northern Trust?
Yes, we have a very successful support group in the Northern Trust. It's been running now since 2009. We meet on the first Thursday of every month at the All Saints Parish Centre in Ballymena, and the patients choose the topics that we cover. We cover topics such as dietary advice, physical exercise, coping mechanisms, emotional support provided by our psychologist within the Trust.
And David, could you tell us about the support services that the foundation provides for those with lung cancer and possibly to their family and friends also?
The support services encompasses a number of things, whether it's from the information material we produce, which goes out to all the lung cancer nurses in the UK. It provides information on treatments, signs and symptoms, diagnosis, the pathway of which they're going to go through as a lung cancer patient. And that information can provide a sense of understanding and hope, in that they know what's going to happen with regards to what treatment they're going to go through, how it's going to go through and what will happen. But in turn, we also have offer financial support in the term of a patient grant. This is a one-off payment of up to £200, which can be applied through a lung cancer nurse such as Sally, or either a local GP. And this can go for anything, whether you need like a holiday or you need financial support for new clothes because you've lost weight. So it's just a payment there so to help patients and carers.
Could you tell us a bit about the signs and symptoms possibly of lung cancer?
Unfortunately, the signs and symptoms of lung cancer are very similar to a lot of common symptoms that people experience, but it's changes in symptoms that we're always looking for. So if you have a cough, a persistent cough, or a change in your cough, if you've had a chest infection that hasn't resolved with an antibiotic, hoarseness, shortness of breath, new chest pains, new coughs or colds, or persistent cough or cold, and also then if a patient was coughing up blood or even rustic coloured sputum, then those would be the things that might alert you to go to your GP. But certainly if a patient is concerned, they should raise those concerns with the GP and have further investigation through chest x-ray and CT scan.
And finally, David, if anybody wants to get more information or reserve a seat for the information, how might they do so?
If they'd like to come along to the information day, then all they have to do is get in touch with Roy Castle. They can call us up and ask to reserve a place, or they could get in touch through the lung cancer nurse, that we advertise it with them, or they can go through Eventbrite. It's another way to get in touch with us. And also in our office, in maternity support services, we have our new nurse support line.
What services are available for those who call the helpline?
Even if you've got signs and symptoms and you're needing extra advice on where to go, what are other symptoms they could be, and we could pass the information on to you. But also if you were looking for any other information in terms of financial support, or you're looking to any information about carers or support groups, the nurses that we have there are able to answer your questions or to pass you in the right direction to where we can help you the most.
Great. Well, David and Sally, thanks so much for being with us here today.
Thank you.
Thank you.